You're familiar with the term autism. Well, everybody has heard of it. It's a controversial term. In this video, I'm going to be talking to Dr. Daniel Berger about this idea of autism, and hopefully we'll be able to give you some biblical answers and solutions. Hello everyone, Rick Thomas here with Daniel Berger. We're doing Life Over Coffee with Daniel Berger and Rick Thomas. We're talking about autism here. Daniel, you have interacted with quite a few folks in your counseling career with autism. You've studied it as well. This topic is controversial. If you mention the term, everybody's got an opinion on it, and those opinions can be diverse, even within the Christian world. But obviously when the secular world gives their input, then it becomes more diverse. And so my first question to you is, what is autism?
So autism, much like other psychiatric diagnoses, is a construct, but we have to be very careful in separating this one from other constructs, and that is simply because we're talking about symptoms that are physically caused. So it is a way to describe something that they're not sure quite what it is, and because of that, it's very controversial within secularism. I think part of what causes it to be so controversial is the fact that the spectrum, if you would, so it's called autism spectrum disorder, doesn't have clear boundaries. So from the beginning to the end, so the most severe to someone who we would say is highly functional, there's not clear boundaries. So what you have now is people looking at the symptoms and saying, well, my child fits on this spectrum somewhere, and children that clearly have problems are sometimes being minimized with their problems because a child who's just having social issues, doesn't have a lot of friends, is being called autistic. Okay,
so autism is a construct. It is a label that describes something very real. And then within that, there is a spectrum that can go from mild to acute. And the third thing is we really don't know what causes all this. And so we have a label describing something. We have a broad spectrum of different iterations of it, and then we're not sure what it is. So that does open the door to a lot of speculation and trial and error and opinions.
Yes. And I think it's helpful to just to briefly here discuss the three basic symptoms, if you would. And because this is a subjective construct, there's many other opinions of this. But if you were to study autism, or you know someone, or you yourself have a child diagnosed as autistic, there's three things basically that are common, if you would, with on the spectrum. And again, this is excluding kids that just have behavioral or social problems that are being called autistic and being placed on the spectrum. These are what I would say legitimate cases. The first is sensory processing issues. So they've actually created a whole other diagnoses just for this, but all of this amounts to the same concept. We're identifying children that have sensory processing issues. So for example, giving attention, the eyes and the ears, specifically those two attentive organs. A child that should be paying attention to movies on a consistent basis finds no interest in what a normal child, and I put that in quotes, would find interesting. So sensory processing, they find a lawnmower to be almost painful, or even painful. The noise just makes them freak out, if I can say it that way. So you have on one side children who are heightened senses, they can't handle loud noises. They can't. On the other end, they're struggling with hearing things, etc. So when we talk about sensory processing, we're talking about a wide variety of things.
So on the hearing thing would be universal as far as sensitive to loud noises. It wouldn't matter where the noises are, what time of day, whatever the situation is, it would just be a problem.
Vacuum cleaners. Now, for some children, it is specific. It's not just a fear of a vacuum cleaner, as an example. It's actually the noise that is And let me say this, that this is the controversy part. First of all, our sensory processing is already on a spectrum, right? My wife doesn't have good eyesight at all, but her hearing is just phenomenal. I don't have good hearing, but my eyesight is.
Or you have selective hearing? Or
Well, that could be argued, yes. So we're already on a spectrum, right, on sensory processing issues, and you throw into this mix this whole idea of somehow this child is abnormal. So again, this is the controversy: is there's already a very wide variety of processing levels, if I can even say it that way.
Is part of the problem would a parent be hearing someone downplaying the problem by saying that it's by normalizing it, or trying to, not that you or anyone would be doing that, like, well, my wife or my son struggles this way and this is kind of like normal human behavior? Would they be hearing that, oh, well, no, what I have is, it's not exactly that, but that's not what you're saying. You're just trying to say that there is this abnormality, or this is the way we are at a very base level, and then there are folks that have an accentuated issue, struggle, or sensory problem.
Yeah, so and this is helpful too, and that's a good question to lead into.
Are they hearing? You're marginalizing what I'm saying.
Well,
here.
I'm not marginalizing.
No, I'm not saying you are. I'm saying, would a parent hear that?
Absolutely, yeah. And so you just taking one of these, and I'll use the word symptoms because they are, you're probably not going to be giving a diagnosis of autism, but you combine the three, and so obviously as we move forward in this video, we'll talk about the other two. But by combining the three, you're looking at kind of what we would say, yes, looking at this child, they're autistic.
Right.
And so the other two are repetitive behavior, and we're not talking about sinful behavior like what we would call an addiction. So that's an interesting topic too, the distinction between amoral behavior, so an obsession with water. A lot of children who have been diagnosed with duplicate Q15, for example, which is a syndrome, they become obsessed with climbing. So we're not talking about sinful behavior here. We're just talking about repetitive behavior that we would look at and go, that doesn't make sense. Why the fascination with water here? And it's interesting because in I believe it's 1 Samuel 21, David actually pretends to be, in most translations say, mad. And it's a different word than is used in the following verses, where the guards that are looking for David actually use the word mad, that means deceived. So they look at this guy and they actually say he's insane or he's deceived, versus what David is pretending to do. And that is the word used for discernment. And it's fascinating, that word discernment. We can talk more about dementia in other videos, but I believe in Job 12 that word is specifically used, talking about removing the discernment of the elderly. Nonetheless, what David does is he's marking in the doorpost, it says, and that's repetitive in the Hebrew. So he's marking repeatedly, and so there's an amoral behavior, and then the Bible says he's drooling. Mm-hmm. So you've got motor skill impairment, and you've got repetitive behavior there. And it's fascinating. So he's actually pretending to be someone who is clearly has a problem there. And again, that's someone who's lacking discernment. And that's the word that is used there. Or it's also used as taste. So we taste food, and if it's spoiled, we're going to spit it out. That's that idea of discerning. These are people who lack that ability, is what Scripture says. So what we're describing there is amoral repetitive behavior. And then the third is social impairment. This is where it gets controversial. A lot of children are being diagnosed, again, because they're having social issues. Well, one of these is not a qualification of autism. I would say, and again, this is all subjective. I would say it's a combination of these.
Yeah, so that helps answer the question. If you were to isolate any one of those, then yes, to some degree, all of us I mean, I can be socially inept and
Right.
have social issues, or we can have fixations on things that we struggle with, but those are isolated. But then when you bring all three together, then you may be on the spectrum, and then now you can move depending on, it can get worse and worse.
Right. And it's actually classified as a neurodevelopmental problem. So the development is key. So versus a neurodegenerative disorder or disease like Alzheimer's disease as an example, this is not a deterioration. This is actually a developmental. So what they're saying is the child can still develop. Now, it's not going to be on the level, and
Right.
especially in severe cases.
Right.
But that is important, and hopefully we'll be able to do another video for next week and talk about how to help these children, both as families, but also as churches. But that is what we're looking at is this child clearly has problems in all of these areas, not just one of them.
Okay, so in the next video, I want to ask you, you mentioned earlier, or implied anyway, the dichotomy. There's an organic problem, there's a spiritual problem. I want you to walk me through that. And then, of course, as you're saying here, we want to also offer help. What can parents do as if they have or believe they have an autistic child? We're talking about autism. We're at the end of the video, so this is part one. There will be at least a part two. Daniel, thank you so much. And if you have any questions that you want to talk to us specifically about, whether it's autism or something else, just please put a comment in. Thank you for those of you who have commented and you have made suggestions of topics that you want us to do. We do have a list of topics, and so we're going to work through those in the upcoming videos. This is Autism Part 2. We'll be back next week with the second video.